The etonogestrel implant is a small, thin plastic rod that gets inserted under the skin to prevent pregnancy. It slowly releases etonogestrel, a hormone similar to the one made in your body, over a 3-year period. It's important to note that this product does not contain any estrogen. It's worth mentioning that this medication may not be as effective for women who are very overweight or those taking certain drugs, so it's important to discuss your birth control options with your doctor. Also, it's important to remember that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. Before getting the etonogestrel implant, make sure to read the patient information leaflet provided by your pharmacist or healthcare provider. If you have any questions, ask your doctor or pharmacist. Ask your doctor about the best time to schedule your appointment to have the rod placed. Your doctor may want you to have a pregnancy test first. The medication usually starts working right away when the rod is inserted during the first 5 days of your period. If your appointment is at another time in your menstrual cycle, you may need to use a non-hormonal form of birth control, such as condoms, diaphragm, spermicide, for the first 7 days after the rod is placed. Ask your doctor about whether you need backup birth control. The rod will be inserted under the skin in your upper arm by a healthcare professional. Usually it will be placed in the arm that you do not write with. Be sure you can feel the rod underneath your skin after it has been placed. If at any time you cannot feel the rod underneath the skin or feel that the rod has been bent or broken, tell your doctor right away. There will be 2 bandages covering the area where the rod is placed. Leave the top bandage on for 24 hours. Keep the smaller bandage on as directed by your doctor, usually for 3 to 5 days. Keep the bandage clean and dry. The rod must be removed after 3 years and can be replaced if continued birth control is desired. The rod can be removed at any time by a trained healthcare professional if birth control is no longer desired or if there are side effects. Some common side effects of etonogestrel implant may include nausea, stomach cramping, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation. You may also experience pain, bruising, numbness, infection, or scarring at the site where the rod is placed. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Your periods may be early or late, shorter or longer, heavier or lighter than normal. You may also have some spotting between periods, especially during the first several months of use. If bleeding is prolonged or unusually heavy, contact your doctor. If you miss 2 periods in a row, contact your doctor for a pregnancy test. Remember that the benefit of using this medication is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you experience any mental/mood changes, lumps in the breast, unwanted facial/body hair, severe stomach/abdominal/pelvic pain, unusual tiredness, dark urine, yellowing eyes/skin, or coughing up blood. In rare cases, people using this medication have had very serious problems from blood clots. Get medical help right away if you experience shortness of breath/rapid breathing, chest/jaw/left arm pain, unusual sweating, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, sudden/severe headaches, trouble speaking, weakness on one side of the body, or sudden vision changes. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. If you notice other effects not listed above, contact your doctor or pharmacist. Before using etonogestrel, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including any history of blood clots, high blood pressure, depression, diabetes, heart problems, liver or kidney disease, smoking, and other conditions. Additionally, be sure to inform your doctor about any medications or herbal products you are currently using. It's important to note that this medication may cause dizziness, and alcohol or marijuana can intensify this effect. It's advisable to avoid driving or using machinery until you are sure you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. Etonogestrel may cause dark areas on the skin, which can worsen with sunlight exposure. It's best to limit time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulties wearing your contacts, so it's important to contact your eye doctor if these issues arise. It's crucial to avoid using this product during pregnancy, as it may increase the risk of a serious pregnancy problem known as ectopic pregnancy. If you become pregnant while using this product, it's important to inform your doctor immediately. Additionally, this medication can pass into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that certain medications can interact with etonogestrel implant and affect how well it works. This includes drugs such as griseofulvin, modafinil, rifamycins, like rifampin, rifabutin, ritonavir, St. John's wort, and drugs used to treat seizures or HIV. If you start a new medication, it's crucial to inform your doctor and discuss whether you should use additional reliable birth control. Additionally, if you experience any new spotting or breakthrough bleeding, it's important to let your doctor know, as these may be signs that the birth control is not working as effectively. Lastly, be sure to inform lab personnel and all your doctors that you are using etonogestrel implant, as it may interfere with certain lab tests and cause false results. If the implant is swallowed, it can be harmful. If someone has swallowed it and experiences severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. It is important to have regular physical exams, including lab tests, while using the etonogestrel implant. This may include checking your blood pressure, breast exams, pelvic exams, and pap smears. It is crucial to follow your doctor's instructions for examining your breasts and to report any lumps immediately. Make sure to keep all medical and lab appointments and consult your doctor for more details. The etonogestrel implant is a long-acting form of birth control that is placed under the skin of your upper arm. It releases a hormone called progestin to prevent pregnancy. It is effective for up to 3 years. The implant is a small, flexible rod about the size of a matchstick. It is inserted by a healthcare professional and can be removed at any time if you decide you want to become pregnant. The implant does not protect against sexually transmitted diseases, so it is important to use condoms for that protection. It is important to use this medication as directed by your doctor. The daily dosage is consistent, and the best time to take it is as soon as possible after the start of a menstrual period. The etonogestrel implant is a small, flexible rod that is inserted under the skin of the upper arm. It releases a hormone called progestin into the body, which helps prevent pregnancy. The implant is over 99% effective and can last for up to 3 years. It does not protect against sexually transmitted infections, so it's important to use a condom for added protection. The implant is a great option for women who want long-term birth control without having to remember to take a pill every day. It can also be used while breastfeeding and does not interfere with sex. The implant is inserted by a healthcare provider and can be removed at any time if desired. It is a safe and convenient option for many women. This implant is not something you can do at home. It needs to be inserted by a healthcare professional at a hospital, clinic, or doctor's office. It's not something you can store at home or administer to yourself. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.